unique effect. I would say that, okay, unique effect on each product, and their system work differently. Okay, first of all is my favorite line, which is isotonics. Okay, if you are not from a medical background or healthcare background, probably absorption means nothing to you. Yeah, but absorption means a lot to us healthcare worker. Okay, especially for doctors. Yeah, when you are sick, okay, the first doctor you will go to or first facility you go to is a normal clinic, right? Then we give you what? We give you tablet, we give you pills so that you can take and ingest, and then it will work for you, right? But if it doesn't work, okay, for example, some infection, okay, maybe you have a knee infection, okay, and then if the oral medication doesn't work for you, what you have to do? You go back to the same doctor, right? Doctor probably say, oh, you probably need a injectable medicine, okay, because your body can absorb well. So when you go to the hospital, you are admitted, and then doctor give you injection every day. Okay, it's the same thing actually. The antibiotics probably are the same. Okay, of course they can be a second line, third line, but probably are the same. Okay, but what is the difference is the introduction method. One, pills and tablets, you swallow it, okay, through your digestive system, your body absorb, okay, but the rate of absorption will be low, okay, probably just 20 to 30%. Okay, the most is 50%. If a special design one can go up to 70%. Okay, but the injection is a direct method. We have to put a granula or a needle, okay, in your vein. So the medicine straight away directly injected into your vein, into your blood circulation. So it can be directly picked up by your body and be used. Okay, so we have a special term for this. It's called bioavailability. Okay, so a normal food, the amount of we absorb is actually very low, less than 50%. But when we inject, okay, it is to be said that it's 100%. Okay, 100%. The reaction is very fast. Okay. All right, so that's why when I was told that this isotonic system has a 95% absorption without being injected, without being put a needle on, so I was amazed. Okay, that I really want to try it, and I did. Surprised by the speed. Okay, how it works. Okay, first of all, we have to understand the normal physiology of a human body. What happened when we eat? Okay, what happened to our food when we eat? Okay, when we eat to our mouth, right, this food will be pushed into our stomach for further digestion. So digestion actually starts from the mouth itself, okay, and then it will be continued throughout the whole digestive tract. But absorption doesn't happen in the mouth. Okay, the first part of the organ that will absorb certain things is actually the stomach. Okay, but stomach only absorb two things. Do you know which two? How many of you are a first timer over here? Have you listened to my talk before? Just if you are new here, just raise up your hand and you want to do a rough calculation. All of you have listened to my talk before. Okay, good. So I must bring it to a further stage, right? Third time already. Good, great. Then you will be expert, right? Okay, so where were I? So two things that you will absorb, okay, in the stomach. Your stomach will absorb. First is the alcohol. All right. That's why some people, they drink alcohol, the face will turn red immediately. So part of the alcohol will be absorbed, in the stomach itself. The second things is a certain medication that is specially designed to be absorbed from the stomach itself. All right, there's still some first timer over here. Yeah, welcome. Thank you. I hope you continue this journey of studying health. Okay, so what stomach do? Stomach will pump in hydrochloric acid and make this food, okay, diluted. Okay, become a certain pH. All right, and a certain osmolarity, a certain pressure to be safe, and then the stomach will say that, okay, it is ready to be absorbed, okay, and then we'll push the food into small intestine, where most of the nutrients, up to 90% of the nutrients, is absorbed in this throughout the whole length of small intestine. Okay, so when we want to absorb a full nutrients from the food, okay, the duration, okay, the food stay in the stomach should be as short as possible. Okay, because hydrochloric acid will destroy the nutrients. The longer this food or supplementation or nutrients that stay in the stomach, it will affect the quality. Okay, it will destroy the quality of nutrients over there. Okay, then when it was expelled into the small intestine for absorption, there's nothing much. Yeah, nothing much left to be absorbed. Yeah, so the shortest time is the better. That's why this isotonic formulation is so powerful and so natural, is that we mixed it before we even swallow it. We make this isotonic solution into isotonic form with the correct pH. Is around 3 to 4. Okay, no, 4 to 5, that we can actually readily be absorbed by our small intestine. So it's like drinking your own tears and your the breast milk. So it is something that is so similar to our blood. Our body immediately recognize it, and then it is readily be absorbed. So if you know what is a hypertonic, and isotonic, it will be better. If you don't, you just imagine mask, face mask. Sometimes when we apply face mask, right, there's an instruction there saying that, oh, you have to apply for 20 minutes only. What happens if you apply more than that? If you put on your mask more than that, it will it be better? Not really, yeah. Because when this mask was applied on our face, the mask is actually hypotonic. So hypotonic mask, the water substance inside, right, bringing all the nutrients, the goodness in the mask will absorb into our skin. Okay, because our skin is isotonic, right? Hypotonic will go to isotonic. So we absorb, okay, this substance, this water. So, but if we apply more than 20 minutes, all right, the mask will become hypertonic, okay? It's the other way around. It will actually draw this water from our skin, okay, into the mask. So it doesn't help our skin to glow in any way, right? So that's the difference. The best is high isotonic stage. Okay, isotonic stage, if there's a solution, right? Okay, if this is an isotonic solution, if we put our red blood cell inside this solution, there will be nothing happen to our red blood cell, because it's the ideal medium, ideal environment for our cells to live in. All right, so isotonic is the best. Okay, and now we pre-mix it, okay, in the external environment before we even swallow it. So we help our body to absorb this thing, okay, to digest this thing. That's why isotonics is designed designed for a better absorption. All right, it's easy to swallow. Okay, I still remember when I was pregnant, when I tried to swallow this tablet of calcium, so huge, 2 or more. Okay, it got stuck in my throat. Okay, for some of the people, for some senior citizen, because when we age, right, we have reduced saliva production. So there will be difficulty in swallowing solids, especially tablets like this. So a solution is a better way for them to actually take in, okay, this supplementation. And all these nutrients are concentrated nutrients. There's no binder fillers or whatever that we don't need in our body, or concentrated nutrients. So there's nothing that's extra that we need that is inside, okay? Not extra. So that means no artificial things inside. So normally, the supplementation we see is in tablets and pill form, right? So back then, okay, maybe 20 years ago, when supplementation start to surface, yeah, a lot of factories, a lot of company want to introduce supplementations, but nobody actually paid attention on the absorption that time. So what happened to this patient is that she was just doing a normal screening, but doctor realized there are like a bullet kind of thing that is in the abdomen. So when the doctor asked the patient what did he take, or was he injured, okay, he didn't say anything. Okay, when we asked for further history, found out that actually every day he would take supplementation, and those supplementations, the form is exactly what appeared in the X-ray. So terrible. What happened was, it was supposed to disintegrated, right? To be disintegrated in the stomach, but it didn't. All right. So the form is still there. It's just a child swallow a shillings, and we can see the whole shilling is there because it's not digested. Okay, metal cannot be digested, right? So this is what happened in this case. Supplementation, okay, the pills and the tablets was not digested. Okay, so it was a terrible thing. Okay, waste waste of money is one thing, the effect on health is another thing. Okay, it increases the burden to our digestive system and health. All right. So nowadays we really pay attention on the absorption. Yeah, absorption means the efficiency of the delivery system. All right. It's just like when we want to send a team of astronauts to the moon, right? Without a good rocket, this team of astronauts cannot be delivered to the moon. Okay, so there's no use if you have excellent nutrients. So what's the use if you don't have a good delivery system? All right, so it makes a big difference. Okay, and of course, all the nutrients inside are comprehensive and it works synergistically together. Why? Because if you pay attention to the type of nutrients contained in each bottle of isotonics, right? It is never a single nutrient. For example, our calcium is calcium with vitamin D, with boron, with magnesium, right? So all the vitamin C, okay, some others. So all these things works together to increase the absorption of calcium into our body and direct it into our bone. Okay, it works synergistically together. Why we want to design it this way is actually we want to prevent. Okay, first is to increase the effect, right? Okay, deliver what it was supposed to do. Okay, second thing, actually it can prevent intoxication. Okay, everything works in harmony. Why we encourage you to take whole food? Because in the food it contains a package of nutrients that is designed to be absorbed. All right, to be absorbed and work nicely together, work harmoniously together. That's why we encourage whole food. But when we want to take it like externally, extra supplementation, but we only take it in a single form. For example, you say, oh, today magnesium is very important. I only want to take magnesium every day. Okay, watch out. Okay, you might get intoxication if you only take a single nutrient without any other things that help it to absorb or counteract the effect. Okay, so it is very important that everything works in package. All right, so you don't have to, you feel safe when we take isotonics. I feel safe because I know that it's going to work well, okay, in our body. Okay, so it's palatable, it tastes good. All right, scientifically based. All the nutrients in isotonics, not just isotonics line, in the whole exclusive product line, all the nutrients and formulations and patented ingredients, they work very well and they are scientifically based. All right, because shop.com actually pay a lot of attention on clinical research. All right, that's why I love a lot about our exclusive products, because it works well on human nature, not just in the lab. So standards are high. So this diagram actually very well demonstrated the difference between a normal supplementation in pills and tablet form and the isotonics that we are taking. Just look at the bottom of the chart. Okay, when we take in a normal capsule, right? At the first minute, okay, nothing happened to the capsule. Okay, our stomach has not worked to even digest it, and the 40 minutes is still there. Okay, our stomach need time to digest certain food. For clear fluid, okay, we need around 2 hours. For breast milk, we need around 3 to 4 hours. And then if a normal simple meal, for example, porridge, we will need around 6 hours. If you had fatty food, okay, just say a guess, how long do you need a fried chicken, KFC meal one? It will take around 10 hours to 12 hours, yeah, to digest the food. Okay, that is how our stomach the time our stomach need to digest the food. All right, so in isotonics it's different. Yeah, by the first minute when we swallow this isotonic, okay, the pyloric sphincter, okay, there is a door kind of thing located between our stomach and small intestine. Yeah, when the food is ready to be absorbed, this door will open and let this food falls into the small intestine. So when it's not ready, it's not going to open their door. If you're not hard, also it's not going to open, okay, unless you push it. Okay, so anyway, just a joke. At the first minute when we swallow isotonics, our stomach immediately detected that it is something that is ready to be absorbed. So this door will automatically open. At the first minute, it is already being expelled into the small intestine for absorption. So when the 40 minutes is totally totally empty. Actually, don't have to wait for 40 minutes. Yeah, just 5 minutes will do. All right. If your stomach is completely empty, what do I mean by completely empty? Usually when you take health screen, doctor will ask you to fast, right? Okay, fast properly so that your cholesterol level, your sugar level can be detected in a well manner. So fasting to us is like 6 hours at least, yeah, 6 to 8 hours. That will make sure that actually your stomach will be completely empty. So the best time will be in the morning, okay, if you don't take a supper too late. All right, so usually I don't take anything after 10 o'clock. So in the morning when I got up, my stomach was completely empty, so it is a perfect situation to take in isotonics. Yeah, so after 5 minutes it will be absorbed. If you want to take like 4 to 6 cap each time, okay, give it a 15 minutes, it will be totally absorbed well. All right, so I think it suits our lifestyle, okay, nowadays, because we are so hurry, right? We are rushing in time. So if after you woke up, you just take your isotonics, brush your teeth, okay, put on your clothes, okay, get yourself ready, and then you're ready. Okay, it's already been absorbed, and then you're ready for your breakfast, and then you can head out to office. So it's very predictable manner, okay, to absorb these nutrients. All right. Therefore, what we are promoting here is to increase this gastric emptying time. Okay, this is a scientific term which means a lot to us. For me, I love to predict the things that I want to do. If I take pills and capsule, I do not know whether my body absorb it or not. I do not know whether I will waste the money or not. So why not just change the isotonics? It's so predictable, 95%. And I know even if I'm not empty stomach, how to say, like some people would like to take it in the evening, right? That time you have already taken your breakfast, you have already taken your lunch, probably you take a full meal. So your stomach will not be completely empty, but it is fine, okay? It is even better than the normal supplementation in other forms. It works better. Maybe it's not 95%, at least 80%, all right? But best will be empty stomach, okay? Because the science told us so. Okay, so now go into the isotonic product, okay, one by one. So if you have your catalog with you, please take out your catalog and then jot down the notes that you hear or the points that you love about these products, because I'm going to mention a lot, and then probably some you have never heard before, or it never come across your mind. Okay, some maybe you know that your friends or family are experiencing, and then they need it, so you jot down. Okay, it will make a difference to you and your friend's health. Okay, so if you are new to our isotonics, probably you'll be confused like how to take it. Okay, isotonics, right, it is in the powder form. All right, this is our called Q10. Okay, it is in powder form. It is designed to have one cap, okay, or one spoon. Okay, if you don't, you can actually get this from our partner store. Okay, one spoon of this equal to a cap. Okay, mixed with 60 cc of water, and then it will be isotonics. So if you want to take 4 caps, how much of water should you put into your cup? You know how to do calculation, right? Don't sleep. Not time yet. So this is the cup, right? I like to use big cup, make sure you're not using the cup that comes with the bottle. It's just for measurement. If you're using that cup, you're gonna take how many times? You're gonna take a long time to actually take your isotonics. So just buy this cup, okay? In our partner store, there are 300 mils. There are I think 240. Yeah, this cup from America, so it can actually serve 10 serving. I love this. There's one shot you can actually take 4 to 6 caps. Yeah, so around this much. Okay, drink it slowly lah. It will save you a lot of time. So when you take your isotonics, okay, so if you want to take 4 caps, of course, 4 times 60 cc of water, 240 altogether. All right. So this is Q10, okay, post meal. Okay, usually I put you can buy this cap from partner store also. It's easy. Okay, you can totally open up the seal and then change to this cover. Easy to pour out the powder. Okay, so you just mix it into your water. Okay, so this is also something to take after meal. Vitamin D. Okay, with K2. I love this because it tastes like strawberry, you know. I'm a bit surprised. Nice. So mix it together and it will bubble. It will bubble. That is normal, okay? You don't have to wait for all the bubble to settle before you drink it. You can drink it immediately, and I advise you to drink it immediately also, or else you'll turn into something else. No lah. Just try to drink it immediately. Yeah, it works the best. Okay, so I said this is how you mix your products. So if you want to, I always take the maximum cap every morning, 6 caps. Okay. Okay, next. If you are taking